I'm Cathryn Hoy. I'm a proud registered nurse, president of the Ontario Nurses Association. We represent 68,000 registered nurses, healthcare professionals, and 18,000 future nursing students. I am very pleased and thankful to be joined today by Thierry Mesana, President and CEO of the University of Ottawa HeartInstitute, to continue to bring attention to the dire state that we are in our public healthcare system. And honestly, there are clear solutions that are out there, and we urgently need these to fix what's going on in healthcare. It's not often that, and in fact, I haven't seen it, where we see a hospital CEO and a nurses union speaking side by side. But we are here together today because we both see the crisis that our public healthcare system is experiencing right now, and we do agree there are common solutions that we can work together towards. There's been, in the last few weeks, approximately 25 ER closures, reduced ICU capacity, reduced levels of care of ICU, silent closures that you would not believe if we had a list of those silent closures in the recent weeks. And we know at the end of the day that the people of Ontario are not getting the care that they need and what they deserve. It was very disturbing to hear that our health minister refused to take privatization off the table, and Premier Ford's confirmation that he's planning to privatize the delivery of even more healthcare services. You may be able to tap your health card like you do at the grocery store for service, but at the end of the day, provincial taxes will go up. There has to be an increase in funding to pay for that service. It is not free. If the government can't influx money into the system right now and fix our public health care system, how is this going to help? It will come at a price. We cannot have our government look at the crisis in our public health care system as an opportunity to create private profit. Money needs to go first and foremost in the current system and not into investors' pockets. That's inappropriate, and it's not what Ontario is all about. And let me be very clear, privatization would only make patient care worse. It has been a proven fact in Canada. The most troubling parts about our healthcare system are the ones that are already privatized. Let's look at home care, where 45% of patients can't get the care they need. It's sad to think that people are at home alone and no one's there checking on them. Long-term care, where the private operators had more deaths during the pandemic than anyone else. They even locked up PPE after they left at 4 o'clock so that the staff could not obtain PPE and be safe. We need to work together. We all need to work together and convince this government to take immediate steps to keep the nurses we have, retain the nurses we have, bring back the nurses that have left their jobs, and bring on board new nurses. Bill 124, if I haven't said it once now, I've probably said it a million times. I feel like a broken record, but I'll keep starting the needle at the beginning of that record because it has to be repealed. Nurses have to be compensated fairly. Currently, agency nurses is costing the system millions of dollars that do not need to be spent, and that's taxpayers' money, your money. I am seeing hospitals in Ontario that their agency nursing is up times 4, times 7. These agencies are billing out $200 an hour per nurse. In fact, we just read an article where 21 nurses left an employer to go to agency, only to be returned to that same employer to work. I had a text from a nurse this morning where one of their full-time lines were actually hired into by an agency nurse. $200 an hour, they could have had 4 nurses for that price if they repeal Bill 124 and pay the nurses fairly. It is honestly the first step to give the nurses hope, because if we don't, they're going to keep going to agency, and it is going to break the system. That hope will make them feel that they're respected and that they're valued, and will give them some relief that the tables are going to turn and our public health care system is going to remain intact. The government needs to invest in bringing back the retired nurses. They are such a valuable asset because our new graduates need that support. They don't come out of school that they can hit the floor running. It takes years of skill development, so we need to support them as soon as they start. The same with the international nurses. Nursing is different throughout the world, so we need those retired nurses to have the support, so when they come, they can learn and they can be an asset to our healthcare system. And full-time roles, we need those to change. A lot of employers feel that part-time work is the way that we need to move forward. It isn't. It costs more to begin with. And many nurses have to have 2 or 3 part-time jobs just to make up full-time hours, which means, again, it's a cost to the system because they're not available to work when we need them to work. And we need to make it easier for the registered practical nurses to become RNs. 5 years isn't acceptable because they have to work. Skilled trades get to go to school and are paid for. Why are we not doing that for the RPNs? And that, honestly, is one of the quickest ways we can get RNs into the system, is coming up with a program like that. There are solutions. I don't have them all, but if we all sat at a table and brainstormed and agreed on things, I'm sure we could come up with something. We need the government, first of all, to listen to nurses. The people at the front line, they're the experts. I listen to them. I'm not working the front line now, but I talk to my nurses every single day to find out what's going on. They're the experts, and they're the ones that will help us. We need to bring back a stronger public system for everyone in Ontario. And Bill 124 is honestly the first step. So I'm going to turn it over now to Dr. Mesana. And again, he is the president and CEO of the University of Ottawa HeartInstitute. And I just can't thank you enough.
Thank you, Catherine, and good morning, everybody. So, yes, I'm a heart surgeon. I think I have the privilege to have spent half of my professional life in France as the head of cardiac surgery in one of the biggest hospitals in France. And you know, France has a mixed, blended public and private system, which works quite well, actually. And I'm very proud to have come to Canada in 2001 and became the head of cardiac surgery and then the CEO of the HeartInstitute for the last almost 10 years. So I'm here really to support the nurses. Nurses are extraordinary people. They are there all the time for the patients, for the community. We just come out of 2.5 years of terrible, horrible times where nurses have played an essential role in our society. So in 2020, when actually the official rules were that the healthcare workers should not be vaccinated first, it should be by age, I stepped up and said, no, that's not right. And people say, well, you know what, we need to protect the community first. Well, the best way to protect community is protect the people who work in hospital. Because in Canada, what is very specific in Canada, and I can tell you because I spent 22 years as a healthcare professional in France and now almost 22 years here, so half-half. The hospitals are essential, are the backbone of the Canadian healthcare system. That's sometimes unfortunate because it should be a bit different, but that's the case. So when a hospital loses nurses, you lose ED services, which is terrible. So people come to the ED department, they wait for hours. So to me, I really loved when this government came out and said we do want to stop hallway medicine. That was great. That was a great message. I think we're back to that now because we don't have enough nurses. So I think, at times you need to sit down and say, okay, this Bill 124, it was done before COVID. Okay, COVID has changed the whole thing. So why don't we all sit down and say, okay, guys, let's protect our nurses. And this is why I'm here. I'm not a politician. I'm not attached to any political party. I'm here because I know the value of nursing. I've been for 40 years as a heart surgeon. I've seen nurses doing miracles, not just doctors. And they need consideration. In the last few weeks, I have sat down with my nurses at the HeartInstitute. I came to each unit. I sat down with them. They loved it, of course. They like when the CEO comes in the unit and sit down with them. And they shared their worries and their concerns. A lot of them were new nurses. 50% of our staff actually has been renewed during COVID. And you know what? On and on and on. They talk about the Bill 124. And to me, that was really obvious. They felt disrespected. And I think this is really the main concern I have. When you have, a huge proportion of your staff who feels disrespected and not valued, you lose the culture of the organization. And not because of the organization. Actually, they love the HeartInstitute. They say we feel better here than in any other hospital, but why are we treated this way? 1% increase? Come on. When you have, all of you, how much you have to pay a coffee today compared to 2.5 years ago. You know how you have to pay everything compared to 2.5 years ago. Those are many men and women, a lot of women, nurses. This is still the case. Most nurses are women. They are mothers. They have children. They take risks with their lives sometimes. We lost a few. They go home. They can disseminate the disease to their children. Their children have COVID. They have to stay home. And they cannot get to work. And they are not happy about that. So, this is the time to say, listen, let's go back to the blank page and say, okay, what can we do to support the nurses? And it's not only recruitment, it's retention. I heard a lot of new nurses. They say, we love the HeartInstitute, but we got offer from United States to go. We are single, or we are a couple. We don't have children. We get a big bonus to sign in the U.S., so we got to go. Sorry, Dr. Mesana, we love the HeartInstitute. We love you, but we got to go. And so this is what I'm worried about, because in some places, it's very hard to find qualified people. Finding a nurse who is capable to work in a heart center, who delivers open heart surgery, heart transplantations, in cancer centers. Those are nurses. It takes years and years and years to take them to the appropriate skills and level. So we have a good education system in Canada. I understand the value of recruiting outside. I'm coming from outside myself 20 years ago, but first, protect the people you have educated. Protect these people that need your support and show them dedication, commitment to keep them in our healthcare organization and structures. I'm not here to discuss private versus public. I think in healthcare, like everything in life, you have to be very careful not to be too dogmatic. When I say dogmatic is nothing has to be public or nothing has to be private. They may have solutions. I'm not here to tell what's the solution. And I think we have to be very smart and flexible and respectful. So again, I'm here to support the nurses. I'm happy to discuss anytime, or whoever wants to talk to me about this. And I hope that we can all come to the table, the government, the hospitals, the CEOs, and the nurses, everyone, to find solutions, because this post-COVID has to be dealt adequately. We can't keep on the table something which has been voted before pandemic, knowing all the change that the pandemic has done in our world. Thank you.
Questions? Yeah. Ms. Hoy, when you raise these kinds of points, the government says they have launched the biggest recruitment and retention strategy in Ontario's history. So I want your response to their response, but also are they doing anything right in your opinion? I mean, they point to the Learn and Stay grants and the $5,000. I know some nurses didn't get the full amount, but even, their Learn and Stay grant program, is that a good move? Are they doing some things right and they're just more longer term solutions?
Well, they spoke the other day that they hired 10,500 nurses, then 14,500. If that worked, why do we have a shortage now? And they were not nurses, they're extenders that is what they're hiring, and PSWs. So that isn't right. I respect the budget. I'll be brutally honest about that. I do not think that the money is necessarily being spent right, or also it looks like it's more than what it is. So the grants for tuition and expenses for underserved areas, our whole province is underserved. So what defines underserved? There are multiple applicants for every seat in nursing. So there's no need for the tuition grants. What is needed, though, in northern communities is housing. They need help with housing. That is a big issue if we have nurses that want to go there.
Sorry. Can I ask, on the agency nurses, is there some kind of a mechanism, do you think, that would prevent hospitals from going to agency nurses? The Premier said last week, when asked by the CBC if it was price gouging, he said, well, I can't control what happens in the private sector. So he's saying that he can't control the costs that an agency would charge for nurses. But is there a mechanism, do you think, that would prevent or stop a hospital from actually relying on these agency nurses? Or are we at that point where they have no choice but to rely on agency nursing?
Well, he's right. He can't control the private agencies on the price gouging, but he also could probably pass a bill that would limit the usage of government funds to pay for agency nursing, something like that. You cannot tell me the government is the caretaker of our healthcare dollars, and they're not taking care of them. When they're allowing companies to bill out $200 an hour, of course nurses are going to go and work. If they're being paid $110 an hour to go work in my exact same hospital, in my exact same department, why would I not go work for an agency? So the governments or even the employers all need to get together and say, we are not going to do this. It is abuse. When they're paying out $7 million instead of $1 million a year for agency, there's something wrong. So the government could pass a bill and say that you are not allowed to use maybe more than 1% of your total payroll for nursing, something like that, that would limit it. And what that would do is it would bring back the nurses into their place of employment, and then they would be scheduled ready to work, where now it's just-in-time scheduling. They call agencies, can you book someone for the next 3 days? There has to be an answer, because if we go down this road, all nurses will be agency. They'll all be making $110 an hour. They'll all be billing $200 an hour, and our system can't support that. And if the government supports agency, then why don't you repeal Bill 124 and pay the nurses what they're valued at? And that could help with the agency. If you're prepared to pay $200 an hour to them, let's pay the nurses their value.
When Ms. Jones and Premier Ford talk about creativity and innovation, what do those words mean to you? And are they necessarily a bad thing? They're saying, that they stand behind a publicly funded healthcare system, but there might be better ways of delivering it, and they're looking for creative ways of doing that.
To be honest, it means nothing to me, because they won't sit at the table and tell me what they mean. When they say they're meeting with leaders, they're meeting with management at facilities. They have not met. In fact, my meeting with the health minister has been canceled twice. I have one now for September the 27th with the health minister, the deputies, and a few other people. So they're not meeting with the unions, and we're more than prepared to work with them We want the nurses at the bedside. We want the people of Ontario cared for. And there's room for everybody in healthcare. PSWs, RPNs, RN, there's room for everyone. It's just you have to have the appropriate caregiver with the appropriate patient population. And that is what is important.
September 27th feels like quite a long ways away. Are you trying to push that up? You were here at question period last week. I saw your reaction to that from the gallery. What was your takeaway from what you heard the Premier and the Health Minister say in that question period?
I found that question period very difficult because they haven't met with us. They haven't attempted to meet with us. September 27th is a long way away. I'm not available next week for a meeting, but we offered September 12th, September 27th. We could have gotten together earlier, I'm sure, but the government wants to have a full panel to meet with me. I'm good with one-on-one. I don't know why they want to have a full panel of people to meet with me. So their schedule's dictated the 27th.
Like who else is on the panel?
There's the Deputy Health Minister, Lawrence, can you help me out? Dr. Zion, Chief Nursing Officer, and the Associate Deputy, and I think there's one other person. So everyone connected with healthcare. But the 27th is a long time away.
But even if the Bill 124 is repealed, it will be hard for the public sector to compete with the agencies. You called what is happening a crisis. That privatization, you'd say, is not the solution. So what else can the government do? What is the solution?
It's not a one step, it's several steps. Bill 124 will retain people that are already there. Not everyone wants to go to agency. When you go to agency, you don't have health benefits. You don't have a pension. And a lot of people are forward thinking, I will retire one day, and I want to retire not dependent on the government funds. So pension is very important to them. So that will retain a lot of our nurses. And a lot of our nurses love where they live. Their departments are their work families, and they don't want to leave. So that's only part of it. We need the retired nurses to come back and support our new learners, our new graduates, and our international nurses. Our new learners, our new graduates, we should be paying so much attention to them because they are healthcare for tomorrow and we can't lose them. So we need that group in there too. There's multiple steps to make this work, but the government is going to have to do something with agency. Just saying, I can't do anything about private price gouging. Well, you can. As they say to us, think outside of the box, think outside of the box. Create a bill to do something because our system cannot sustain it. And the only way to sustain that then will be to put up your provincial portion of your income tax and pay for it that way. It is going to be devastating. March 31st, their hospital's year ends when we see their bottom line. Like when we have one hospital already $6 million over budget and we have to go till March 31st, they're going to be double-digit millions over budget. And how are we going to climb out of that? I feel for a lot of the employers. I truly do. They're in a hard position. They need to staff. They have patients in those beds, and they need staff to care for them. So they have no other choice but to bring in the agency. But nurses are crying out, respect me, and I'm going to stay. So repeal Bill 124. Take it out of the government's hands. That will come back into the employers and the union's hands.
Dr. Mesana, can I ask you, I know you had mentioned that you didn't necessarily want to wade into the publicly paid, privately delivered system, but it seems like the government is considering that very strongly, of more privately delivered healthcare as long as it's publicly paid. Where do you see the balance here? What would your advice be to the government if you were to give it, in terms of where you could see it strengthened, where the potential pitfalls could be if they went further down that path?
Well, I have my own opinion, so I will express my own opinion, which is not necessarily your opinion or anyone's opinion. I don't think there are so many people that have lived in a publicly and privately funded system like I did in France for 22 years. I've seen the value and the disadvantages. I think that there are things that should never be private. Cardiac care, cancer, child's care, all of that should never, people should never be putting money out for that, never. There are some of the things that may be discussed, that may be more efficiently done in private organization with a blended reimbursement program, which would actually alleviate some costs in the public hospitals, maybe, and actually give better access to people who can't pay. So why do we have a lineup today for doing hip replacements in a public hospital? Why? Why do you need that? Why, when people could be ready for paying for this? I have a friend actually in Ottawa who needed she was an old lady. She needed a hip replacement. She got it done in Montreal, where they have she got it out to Montreal. She paid out of her. She had some private insurance. I don't know exactly what she did, but she didn't want to wait for a hip replacement because she couldn't walk. But we should never do this for certain things. So, but again, this is another discussion. Today, what is important is to support the nurses and to, all this thing about agencies and stuff. When you are at this point of discussion, I'm sorry to say that the horse is out of the barn already. This is too late. So you can be creative, you can do whatever you want. It's already too late. When you have to go to that kind of route, you lost the game already. It's already finished. So what you need to do is a very simple thing. You need to send a signal to the nurses. Yes, we're going to repeal that. We're going to sit down and see what we can do in a reasonable way. So I would not support, I'm going to be honest with you, support nurses say we should have 10% increase. I don't think it should be reasonable. But what is the reasonable increase? Was that nurses then feel comfortable. I am in a country, in a province that understands me. I want to stay here. I want to stay with the culture of my hospital. I don't want to have to work through an agency. I just go to the hospital. They will hire me. I'm happy to be here. I have my family. I have my kids. They go to this school. Why should I change? Nurses are not mercenaries. Why treat them like this? They're just like the culture of, once you build the culture in an organization, you want to keep the culture. The healthcare system is highly dependent on the culture you develop in hospitals, for hospitals, okay? That's very important. And you can, every one of you, the day you would, I don't know if any of you went to a hospital one day for yourself or for someone of your family, and I can tell you, there are hospitals and hospitals. You see what I'm saying? So that means that you have places where you can see there is a culture. The nurses, they love to work here. You have to be very careful how you handle the nursing business. And the healthcare professionals in general. Actually, it's not just nurses. You have a lot of people who work in hospitals, physiotherapists, other people who are patient-facing. This is the face that you see every day. When you're suffering in your bed at night, at 5 a.m., who are you going to call? You're going to call a doctor? You're going to call a nurse? This is the people who come and help you out. So when the people come home and they hear that, you know what, they got to pay just same money every year with no increase. And when they go to pay their bills, they see everything going up, the bread and gas and stuff, and they're not increased. And they have asked them for 1.5 or 2 years to support the entire community. Can you imagine what would happen if the hospitals had shut down completely during COVID? So what I'm saying is that how come we cannot sit down all together? And the discussion is not about the agencies. Come on. That's not. It's a very limited way to see things. You have to bring things on the table. What can be done to support the healthcare workers and revive the hospital system and stop to have this negative messaging that you see on and on and on, who are detrimental to the people who work in hospitals. Because it hurts also the docs. Do you believe that the physicians are happy to see their nurses going away, going to the United States, and not having nurses and not being able to see patients? They're hurt too.
Dr. Mesana, has the Heart Institute had to cancel any surgeries this
No.
summer because of a shortage of
No, and actually the funny thing is I'm the only one who talks, and probably I'm one of the rare ones who didn't have that much of a problem. I never have to do that. So I'm not here for personal interest, actually. The Institute did very well. We were the busiest heart center in Ontario during the entire COVID period because we managed to do what we had to do because our nurses are so committed, so dedicated to the community. So you know what? When I sat down, again, I tell you, I sat down with my nurses the last few weeks. I went to the unit, sat down with them, talked to them. So tell me, how do you feel? How do you feel? Because the mental health of these people is hurt. How do you feel? How do you manage? How are your kids? How are your family? This is simple things. This is not an agency, for God's sake. This is about talking. No, but let me finish. It's about talking to people. And then I heard on and on and on. Why do we have this Bill 124? Why are we treated this way? They are not, just look at simple things. Don't be too technical. Send the right messaging to the people who work for you. That's what I'm saying. This is why I'm here. I'm here to support the healthcare system, not anything else. I don't have personal interest. I'm not a politician.
I was more wondering what the impact on patients has been.
But in the Institute, we were managing, I think we have managed pandemic better than anybody, personally. We have been, most of heart centers were like 60, 70% of the volumes of procedures they were supposed to do. We were above 90%. And we did a tremendous work thanks to the nurses, because the nurses were there. And a lot of nurses didn't take vacations. They asked, a lot of people now in hospitals, because of this, they don't take vacations. So what do you think is going to happen? Do you think the agencies are going to resolve this problem? When you ask your nurses, because they have not enough nurses, to don't take vacation? So what happens? And then you tell them, by the way, you can't also have any increase in your salary. So what do you think is going to happen?
Dr. Mesana, si je peux vous demander
Oui,
en
allez-y.
français, si vous pouvez nous expliquer un peu les impacts de la loi 124 que vous avez observés dans votre hôpital.
Mais je viens de le dire.
En français, s'il vous plaît.
Ouais, ben je viens de le dire, c'est très simple. C'est que les infirmières, ok, vous êtes canadienne?
Radio-Canada.
Radio-Canada, ok. Les infirmières, il faut les respecter. Vous ne pouvez pas dire à des infirmières, allez, travaille, ne prends pas de vacances, 12 heures par jour, et puis bon, de toute façon, tu sais, tu travailles pour l'hôpital public, tu ne vas pas avoir plus d'1%, là. Non, il faut les respecter, il faut leur dire, écoutez, maintenant, cette loi, c'était avant la pandémie, maintenant il y a la pandémie, on a vu tout ce que vous avez fait pour les hôpitaux, pour la communauté, on va remettre ça à plat et on va discuter. Donc l'impact, c'est, je vous le dis, comme je l'ai expliqué, moi je discute avec mes infirmières tous les jours, là. Je descends, je suis le CEO qui va au contact de, je dis toujours, I don't have an MBA, I'm a heart surgeon, so I never had an MBA. I have an MBWA, which is managing by walking around. Okay?
Oh, I like that.
Yeah. So, well, I don't have an MBA, but I ran the biggest heart center in Canada for like 10 years. Donc moi, c'est ça que je fais. Je suis chirurgien cardiaque, je vais au contact des infirmières et je les écoute. Ça fait 40 ans que je les écoute, les infirmières. J'ai jamais vu des infirmières dans un hôpital aussi stressées. Maintenant, partout, elles sont stressées parce qu'elles ne sont pas considérées. Alors, c'est urgent, là, il faut s'en occuper. L'impact est psychologique. Il faut envoyer un signal. Un signal. Pas arrêter avec les agences et tout ça, là. C'est arrêter avec tout ça, là. Stop. I don't even answer any question about that, actually. I don't care about this.
Doctor, so there's also a shortage of family physicians and primary care physicians in the province as well. And they're not affected by Bill 124, though. So then how do you address that problem as well? Because there's a lot of people going to ERs who are going there simply because they don't have a family physician or a primary care physician. So how do you solve that problem?
Bah, c'est tout la même chose. That's the same thing. You know, if you don't have nurses, you don't have ED, then the doctors, they can't work more than they do. So it's the entire system with scrubbles. You need the backbone of the system. I know we have a better home care now. This government has done a lot for community care and work and home care. But the backbone of the Canadian, believe me, I know what I'm talking about. I have been in different countries. I've even worked in the States for a couple of years. The backbone of the system are the hospitals in Canada. Whatever. If you really have the ED system, why the ED system in Canada is so clogged and full of people? Because there is not the same. There is no parallel system to support the people who need emergency care. So when you have a lack of nurses in the emergency department, what do you think is going to happen? And the worst thing about this is that people know this, and because they know it, then we not go to the ED unless they are dying. So you know what, if I not feel well, you know what, oh my God, I'm going to have like 10 hours wait at the emergency department. I'm going to stay home, and maybe it's going to be okay in 10 hours. And 10 hours later, in particular if it's a cardiac patient or whatever, maybe the person is even worse and then needs super urgent care. So this is the entire system is wrong.
So yeah, but should that be the standard though? Because there's a lot of people who are waiting until it gets really bad, and then they were rushed to the ER. So should that really be the standard of care that people should be receiving though?
What do you mean? I don't understand what you say.
Because you said that the backbone of our healthcare system is hospitals, right?
Oh,
should
no. It's the backbone. I'm not saying it's the right thing.
Mm-hmm.
I'm saying the backbone is this way because the support is not there elsewhere. Why would you have to go to emergency department? Because you can't call your doctor. Do you know that in France, actually, I'm sorry to talk about my previous country, the doctors still go to visit patients at home today, every day. My father was a family doctor, and he kept seeing patients at home until 10 p.m. at night. He never stopped, and people go to see patients at home. So I'm not saying they should do that. What I'm trying to say is that why is that so? Because there is not enough doctors. This is a much bigger question you're talking about. Do we have enough doctors in Canada? What's the ratio of physician per inhabitants in Canada compared to other countries? Do you know what it is? It's very low. So why don't we train more doctors to take care of this? They could go and see the patients at home maybe. I don't know. It's another system. It's another discussion today. I don't want to get into that complexities.
Dr. Mesana, just speaking about your experiences in France, though, you had mentioned when it came to the publicly paid, privately delivered system that there were some advantages. Patients might have access to care a little bit faster than in the public system, but you also mentioned some disadvantages. Could you spell out what those disadvantages were in that system in France that you saw?
Well, I think the disadvantages actually is that the probably how would say that there were maybe less effort in some part of the infrastructure of the system, but compared to the the people were not earning as much money as here for sure, compared to Canada, but I never heard any complaint about that over there. And actually, it's a funny system that people. I think there is more doctors, maybe not more nurses, but more doctors than here. So I guess the people have quicker access to see a physician.
From a patient care perspective, did you see a disadvantage in the system where there was more
No.
delivery?
No, not at all. Actually, you can. To be honest with you, you can have any test much faster than here. Yeah, much faster because the offer is you can have quicker access to things like for instance having a regular scan, CT scan, MRI. It's much faster.
So then what would you say to the government? Because, I mean, this is part of their conversation, right? We're talking about a 5,000-foot view to figure out everything in the healthcare system. They seem to be under the impression that more privately delivered healthcare is now...
Who's they?
The Ford government.
Yeah.
Is part of the solution.
But they may be right. I'm not saying they are not right.
Well, what would your advice to them be about
I don't
how
have
to manage patient care in the best possible way if they're going to deliver more healthcare services privately?
Well, I think that then I would have my conversation with the government. If they ask me what's my opinion, I will not express it here.
Premier Ford said yesterday that Ms. Jones would have more to say tomorrow, I suspect when she addresses the ONA conference. summarize it in a nice little soundbite, what do you want to hear from her tomorrow?
She's going to repeal Bill 124. They're going to cap agency nursing, and they're going to invest in rebuilding healthcare with their new learners.
Have you heard anything about like the directive that she gave the colleges, I think almost 2 weeks ago now, and asked them to report back to her? Has any progress been made in terms of speeding up the certification process for international?
I've heard nothing, but I also read that she'd asked them to upskill the international nurses, and the college does not do that. The employers would do that.
Like to cover the cost of upskilling them?
No, the college nurses would never cover the cost,
No, I know
but
that's what
that
she's
was one of
asking.
the directives, to upskill them. So I don't know whether she meant for the college to create courses for them, but that's not their jurisdiction, their licensing period. It would be up to their employers to enhance their training.
The Premier has said more than once now that the province has hired more than 1,400 nurses since they came into power, or 14,000 nurses since they came into power. Have you seen the data that supports that, or are you disputing that claim?
Absolutely, but he's saying 14,000 healthcare nurses, like it's a whole envelope of people, and that is from when they came into power, 4.5 years ago. So if he did do that, why do we have a shortage? Where's the problem? So obviously the data's not correct. It's not. We wouldn't be experiencing what we're experiencing now if he hired. He's hired PSWs. He's enhanced their wages by $3 an hour, which has caused a huge inequity between the registered practical nurse and the PSWs, because it's sometimes $1 or 50 cents an hour difference. So for all the years of school, you're making 50 cents more. That wasn't addressed. So it's PSWs, RPNs. I have not seen the RNs, so I would like to see where those are. And it's extenders, it's the nursing students that they're bringing in. They're not nurses. They cannot work to the scope of a registered nurse. So I would need to see, I guess, the proof in the pudding, because we have not seen it.
Cathryn, we saw the teachers' unions in the government. I believe it's a 2% increase for the lowest paid educational assistants and a 1.25% increase for everyone else. Just wondering if, now that this information is public, if that kind of augurs anything for you and your members going forward.
Well, the 2% is for anyone making $39,000 under $40,000. It just tells me that the government isn't looking at investing into teachers, nurses. Like 2%, 1%. We see that 1% popping up again. They're not looking to invest. Who makes the economy go around? The people that work. And we're not even getting cost of living.
Yeah.
Nothing? You okay?
Yeah.
Thank you very much.